So speaking of horse dewormer, Joe Rogan with Malone here talking about, this was interesting because he kept mentioning financial incentives for these hospitals, and Joe asked him like 3 different times, like, can we come back to that? And then he would start, and then he would get off on another tangent, and then finally Rogan's like, listen, we got to talk about these financial incentives.
For all that stuff, all that noise that's inherent in the system.
Now, you just glossed over the financial incentive to report a COVID death. What is that? What is the financial incentive? Because there's all these rumors that you would hear about what a hospital gets paid per COVID death, and that the government gives them money, and that they're incentivized to make something, mark it down. It's not rumors.
It's not rumors. Now, I don't have the specific numbers at the top of my head. I'm not a hospitalist. I'm not a hospital administrator. But the numbers are quite large. There's something like a $3,000 basically death benefit to a hospital if it can be claimed to be COVID. There's a financial incentive to call somebody COVID positive. The CDC made a determination in year one. This is why all of our baseline data is junk.
What is the financial incentive to say that they're COVID positive? That's why the PCR cycles are ramped up so high?
Again, you're asking causation.
Right.
I can tell you that the hospitals receive a bonus from the government. I think it's like $3,000 if someone is hospitalized and able to be declared COVID positive. They also receive a bonus. I think the total is something like $30,000 in incentive if somebody gets put on the vent. Then they get a bonus if somebody is declared dead with COVID. Okay? So they have an incentive at the front end to declare somebody a COVID case. The CDC made a determination that they were going to make a core assumption: if PCR positive and you die, that is death due to COVID.
So bonus points all around, right?
Oh my word! Yeah, everybody gets their hands patted with some cash if COVID is a determined in any form. And we've even heard locally of an accident victim that died clearly of a car accident that was ruled as a COVID death. And the doctor locally even said, "Are you kidding? Like, this is not right." But so the hospital got paid for it. They had to list it as a COVID death so they could make the extra money.
Right. It's disgusting.
It is. It's horrible.
But it explains why the early treatment isn't being talked about, isn't a thing. Nobody wants to do early treatment because there's no incentive for that.
So he didn't say, at least in that clip, he didn't say that they're getting incentivized per positive PCR test. In a way he did, but he didn't say what they're getting compensated.
Right.
But it's very interesting that, the CDC came out last week and said quarantine goes from 10 days to 5 days with no extra, there's no details on that. It was just like, oh, we're cutting it back because it's shutting down a lot of businesses, which is not helping their bottom line. So cut it back, whatever, with the new variant. But it's interesting that that's where it ended. Everybody changes their policies. All the local hospitals change their policies now and all of that. And now they go meet with the president yesterday as COVID response team. And now they want you to have a negative COVID test before you return to work in many cases. That's their recommendation. So they want you to test to be found out that you're positive. They also want you to be tested again. So if there is a financial gain for testing, then the CDC just again is requiring an extra test for you to go back to normal life, which somebody's getting paid for, I would assume, from that conversation. Mm-hmm. So they're saying all of that and saying we need to require more tests because it's going to make us more money.
Yeah. Yeah, I mean, it does explain a lot about the testing stuff. Never really made much sense.
No, it didn't. And you can go to the store and buy one and scan it, and And I've been listening to quite a few people talk about how the COVID tests actually are super flawed. They make no sense whatsoever because, like, for instance, I traveled out of the country, so I had to have a negative test to get on the airplane, but it had to be within 3 days of travel. So I got my test done on Thursday. I didn't travel until Sunday. Well,
from the time I took my test on Thursday, which it came back negative. So on Thursday, when I took the test at 9 a.m., I was negative. But as soon as I left the hospital, I could have gone over to McDonald's and walked in and somebody could have coughed on me. Boom, I got COVID.
Yeah.
But I got my negative test results.
Yep.
Right. So I walk onto the plane with my negative results, but I'm COVID positive.
It just comes back to common sense.
Exactly. Exactly.
There is none in that logic.
No,
there is none.
More logic is, so today's January 5th. I believe today was kind of like the original deadline for everybody had to be fired if they weren't vaccinated, right?
Yeah.
But like these, the CMS mandate for hospital workers and things like that. So a lot of that stuff was executed. A lot of healthcare workers lost their jobs. And now we know that hospitals have been told, at least locally in our area, I know that if you're vaccinated and you test positive for COVID, as long as your symptoms are not severe, you're supposed to come to work.
Yeah. So the article, which we can link to, Fox 8 News reported this in Ohio. Summa Health Systems said that employees can continue working with mild COVID symptoms, and they're actually calling people, because they're so short-staffed, they're calling people to come back that had been fired because they didn't get the vax. And so they're so desperate now, they're actually telling those people to come back because, well, the mandate hasn't been enforced, right? It's hung up in court. But I find it very interesting that Summa, after firing all these nurses, are now so desperate for nurses that they're willing to let people that are COVID positive, even having some symptoms, to come in and work on patients.
Yeah, because a lot of the opposition to, I know because we were protesting the mandates here locally.
Right.
And a lot of the opposition to that was, if you care about patient health, you should be vaccinated or lose your job, whatever. If you're not going to protect your patients, go find another job. I heard a lot of that garbage. I wonder what those people have to say now that the reports come out that hospital workers are being told, well, even if you have COVID and even if you have symptoms, as long as they're mild, you need to be at work.
Yeah.
So people had to be fired over this virus, and now all of a sudden they need to come to work even if they have it?
Yeah. And to go back to 2020, these people are on the front lines.
Yes.
Right? They're fighting every single day to keep everyone safe. Then they come in with the mandate junk and fire a lot of people.
And they were called selfish if they didn't get it.
Exactly. Selfish if they didn't get the vaccine. Yeah. And now they're saying, even if you have COVID, come on in. We need workers that bad. It is complete craziness. And I know we've said that about every article that we've talked about today, but it is complete nonsense that you're telling people, oh, you didn't get the vaccine, so you're fired, but now we need you back because now you're in high demand. We need you back. And we don't care what your vaccination status is. That's the same with NFL and everybody else, right? Mm-hmm. We're going to go pull people off the streets that were on our practice squads in preseason. We're going to pull them off, let them play, even though they aren't vaxxed, even though it's a league mandate. We're going to do it because if we don't, the Browns and Steelers aren't going to play on Monday night. And so we got to pull those people in.
I remember when you used to be a hero in sports if you played sick or injured. Isn't it ironic?
Yeah.
It is.
The flu game.
Yeah. Oh yeah. And that, I mean, it's money. I mean, the NFL is a great example because they were sitting there going, man, it's week 16, week 17. We got the playoffs coming around the corner. The last thing that they need is to have, the Tampa Bay Buccaneers going into a key playoff game and all of a sudden Tom Brady can't play because he tested positive.
Yep.
Even if he's asymptomatic, but he's positive, by their protocol, he wouldn't have been able to play in that game.
Right.
It ruins playoffs. And now all of a sudden your fan base of the NFL starts to deteriorate because it's like, well, this is stupid now.
Yep.
Right. So we see the hospitals are making decisions on money. The NFL is making decisions on money.
Yes.
I think that the old saying is true. Just follow the money.